Aloha, good Monday morning to all of you. I'm Yenji Denise here with Ryan Kalei-Suji. We are here for the COVID-19 care conversation. And Ryan, we are challenging ourselves technically this morning because we have two guests.
Yeah, not one, but two guests here. Joining us in a little bit will be Governor David Ige to answer some of your questions. So the governor will be coming on in about 10 minutes or so. So we want to encourage you to head on over, share this page, and type in your questions that you may have to the governor. We have a lot of questions coming in. But before that, we have another special guest joining us.
That's right. We have Dr. O'Carroll is here this morning. He is a board-certified emergency medical physician here to talk about the importance of masks. Of course, today there is mandatory mask order on Oahu. And there we see the doctor.
Hi, guys. Good morning.
Very quick there. Masks are now mandatory if you're engaged in any kind of a business transaction in the city and county of Honolulu, and really encouraged statewide. A lot of grocers like Foodland, KTA, other places are now, businesses are now requiring that you wear a mask before entering. So Dr. O'Carroll is here to talk about why masks are so important, who they're here to help, and why they work. So welcome so much. Thank you for being here, Doctor.
Hi, thanks for having me. Forgive my quarantine hair, but it'll get fixed at some point, and we're all going to get through this. So,
well, let's start with the masks. Why are they important? How do they work?
Yeah, they're extremely important in that we have no adequate medical treatments for COVID-19. Unfortunately, we've got a lot of medications and vaccination candidates up the pike, but nothing that's going to work now for us. So our only means of combating this illness is to prevent each other from getting it, as it is transferred from human to human. And so masks are going to help you from creating these respiratory droplets that, as even we're speaking or breathing, they can come out of your mouth and be spread into the environment around us. So when you're wearing a mask, it keeps those respiratory droplets inside the mask. And it's not to prevent you from inhaling those droplets from around other people. It's really to prevent the spread. And so probably the most worrisome part of this illness and what's caused it to sneakily spread across the globe and explode across the globe is that, up to 20% of people, some studies are saying even higher, will never exhibit any symptoms. And that's pretty much on par with what we see with the benign coronaviruses, we like to call them, because there's other types of coronaviruses that were discovered in the 1960s that cause a common cold. And they also don't have 100% symptomatic rate. So there's a certain percentage of people that will have these benign coronaviruses and not display symptoms. That's the same case with this COVID-19 illness. And so it's important that you could have the illness, not know it, and be, shedding it around to the people that you love and that are our communities.
Even beyond this, when COVID is done, do you foresee people having to wear masks, and continue to do this for maybe a few more years? I mean, we see it a lot in the Asian culture and in Asian countries, but is this something that you think could become the norm here in Hawaii and in the United States?
Ryan, you're absolutely correct. And I think you're right in that we're looking at a year to 2 years, maybe even 3 years, until there's an adequate vaccination or therapeutics that we can treat this. Only time will tell how this virus sort of plays out in our society, in our cultures, in that, is this virus going to turn into something kind of like seasonal flu, where it's going to rip around every year? We do know that the benign coronaviruses, we don't stay immune to them forever. And actually not very long, only a couple years, and then we can get reinfected with them. So is that the case with this virus? We know it was sort of the case with SARS. We know it's sort of the case with MERS, the other two related viruses. So only time will tell. Our best hope, I think, is a vaccination or therapeutics, and a vaccination that confers long-term immunity. That would be our best bet. But for now, yes, masks are going to be very important in the next coming couple of years.
If we are going to be wearing these for some time, let's talk about the specifics. We know a lot of folks are making these at home. Some people are making them with these little pockets for filters. Are those necessary?
They're not necessary. I think they just add a little bit of complication, and instead of making 2 in an hour, or I don't know how fast some of those aunties and uncles are making them, but they can make them pretty quick. Adds complication and not entirely needed. As long as you have 2 to 3 layers, 2 is fine. To the mask, you don't need the pocket. Then again, if you're really apt at making these pockets, go ahead. It's tougher to find even the filters as well, and you don't know which filters are really going to work properly. So I would say forego the filters.
Okay, and what about washing them? You wear them out to the store, what have you. I know that one of the things they've been emphasizing is good hygiene before you actually touch them, because you don't want to touch your face with dirty hands and you kind of ruin the point of the mask. But let's say you wash your hands, you take your mask off, and you've been wearing it all day outside. What do you then do with it?
I would, if it's a cloth mask, a do-it-yourself mask, you want to have 4 to 5 of them available to you. I know that could be a large ask, but the reason being is that you want to wash these at the end of the day, because they can become reservoirs for not only the virus because they're cloth, but also for bacteria, other fungi. And so you want to wash them with soap, lots of soap if you have it. And then if you have a dryer, 160 degrees Fahrenheit high heat will kill it as well. If you don't have a dryer, hanging it out in UV sunlight will also kill it, kill virus as well. And so having a good set in your armamentarium and washing them once a day is the best thing you can do for yourself and the mask.
Doctor, we know you're also involved with Everyone Hawaii. And so maybe sort of a final question for you is, how was that? We know that there was a call out if people needed masks, that they could contact Everyone Hawaii. Just maybe give us an update on sort of how that has gone and how that implementation has been working out for you folks at Everyone Hawaii.
Sure, yeah. Everyone Hawaii is a nonprofit where we're trying to get masks to all those who either can't afford or who need them. We are obtaining a shipment of roughly around 2 million surgical masks, and those are ones that look kind of like this. They have the ear loops on the side that eventually will lose elasticity, so they can't last forever, probably about 12 hours worth of use. But if you're going out to the grocery store, that's roughly about an hour, hour and a half, so they'll last for quite some time. If you log into Everyone Hawaii, we'll find their website and get it up on a link for you guys. You can request masks. Right now, we've had a huge response, and we're trying to get those masks out to as many people as possible. But we do look forward to getting another shipment again, if possible, if we can partner again with Hawaiian Airlines. And we really thank them for being a partner with us and getting these masks from China. And we're going to do our best to get them out to the communities that need them, that can't afford them, and to protect our islands. And everything that every single person does, every individual action is a larger collective action that we can do to smash the curve.
All right, Dr. O'Carroll, thank you so much for taking the time this morning. We know you're coming off of a graveyard shift, so we appreciate you and your efforts that you're doing on the front lines as well. Thank you so much, and thank you for joining us today to talk more about these things.
No problem. Thank you, everyone.
Thank you.
Thank you. And Ryan, we want to get people up to date. Of course, we have the governor joining us very shortly. As of noon on Sunday, 6 new cases statewide for a total of 580 positive so far since COVID began in Hawaii. 10 deaths, that latest death, a man from Washington State. They say he was an adult male. We haven't gotten his exact age. They just gave us a range between 40 and 59 years old. No previous health issues that we know of. He'd been hospitalized for some time at Maui Memorial Medical Center. So tough news there over the weekend. 10 deaths now in the state of Hawaii and 580 positive cases. One good number, though, 414 people in Hawaii have recovered out of that 580. So good to see a large number of people are getting better.
Yeah, and then also in other news, there was about 50 people that participated in a protest against the lockdown. And this is not something that we're only seeing here in Hawaii. It's actually happening throughout the country with people that are sort of anti this lockdown. They're saying that they need to get back to work, and it's causing some division, obviously, in the community with these people who are sort of protesting against the lockdown. They actually had a caravan that ran from the Capitol all the way out to Kapolei at Costco. And so we kind of want to hear more about sort of the reaction of this and get to a lot of other questions. Right now joining us is Governor David Ige. Governor, thank you once again for taking time to join us. Your first thoughts about some of these people? I mean, about 50 people or so protesting about this lockdown. What are your thoughts on that?
Well, I just want to really thank everybody because, as you know, Ryan, the overwhelming majority of our community is really heeding the stay-at-home orders, and we do see the impact on the number of cases. So, everyone is entitled to their opinions. We understand that it's been hard. Last weekend was the fourth weekend of our stay-at-home order, but I really am excited about the fact that so many in our community are really staying home and limiting being out and about.
A lot of folks, as you noted, are frustrated, not just the ones who are out on the road, but people at home, they're getting a little antsy. We know that Hawaii is not yet meeting the criteria for phase 1 that the federal government laid out in terms of being able to lift some of the restrictions. How realistic is it that we're going to have this stay-at-home order lifted on April 30th?
I do think, Yunji, that in talking with all the mayors, it probably will be extended. And then what we would be looking at is kind of a phased approach of returning activities and businesses back to normal, for lack of a better word. But we certainly will require all businesses that reopen to implement social distancing guidelines and rules so that we can be certain that the risk of infection is minimized. So, we will probably be looking on a variety of businesses and other kinds of activities. For example, we are talking about medical procedures and working with the hospitals and doctors to begin to allow elective procedures to occur because we recognize that the number of cases are coming down. So we'll be looking at those kinds of categories of different activities to begin to relax some of the restrictions.
Governor, another thing that, of course, is making headlines beyond just dealing with this on the physical aspect and the medical aspect has been the impact that it's had financially on the state. And, last week there was a lot of pushback about the possible reduction in pay for state employees. And you said in your comments that, again, it's still discussions. But, when you think about it, you noted $1.5 billion is the shortfall. And many in the community are already seeing a reduction in pay in the private sector. If it's not coming from state employees and, these cutting pay, where else could this $1.5 billion come from? What other options do you think might be available?
Certainly we continue to advocate. We have calls with all the governors at least once a week, talking with the White House and congressional delegations all across the country. Every single state has been impacted significantly, their revenues from this COVID-19 pandemic. And so every state is hurting like Hawaii is. So we continue to advocate for support from the federal government. We know that this disruption in revenues will continue for a number of months. And the only way that we can avoid significant action to either reduce pay or have a reduction in force is if we get help from the federal government. So, we continue to work with our congressional delegation to really talk about that help, because that would be the best scenario for us to get back to normal as quickly as possible.
USA Today has ranked Hawaii as having the highest unemployment rate in the country now. Besides the unemployment benefits, and we're going to have Scott Murakami on here tomorrow to dive deep into the unemployment challenges. So we ask you guys to hold your questions about the actual system for that until tomorrow, because we're going to dive deep into how the call center is working, how the website is working. But other than unemployment benefits, how can we work to get those people back to work, especially given our heavy reliance on tourism, which cannot come back anytime soon?
Certainly we're looking at different options. The last time in 2009-10 downturn, we had initiated like an environmental corps that we could hire people back and look at fast tracking, watershed protection, fencing, a whole bunch of different kinds of public works kind of projects. So certainly we're talking about that as an option. Looking at working with our farmers and supporting them, in producing more food for us to eat, and obviously labor and availability of labor for farmers has always been a challenge in a lot of different ways. And then, as you have heard, one of the criteria or one of the conditions that would allow us to reopen more activity is really a strong testing program, which I think we have. But it's really about contact tracing and about, if there is an outbreak, being able to find out who the infected person might have interacted with, and then really trying to contact all of them and test them as quickly as possible. So, the notion of hiring some laid off workers to help with contact tracing might be a win-win that would allow them to be employed in doing things that directly impact the COVID-19 pandemic.
One of the things, of course, as continuing on this topic, especially in the tourism industry, some of the other state officials that we've had on this show that we've talked to have been, providing their ideas and their suggestions. One of them being to have all visitors coming to Hawaii to have some sort of proof that they don't have the disease, maybe taking some sort of test that shows that they are clear. But how realistic do you think that will be, given that the tests are already very difficult to come by as is, let alone requiring everyone coming into the state to get this testing? I mean, how do you manage something like that?
Yeah, certainly, Ryan. Based on the currently available testing technology, that's really not practical. I know that people have touted this 15-minute test that Abbott announced a couple of weeks ago, but we've gotten some of those machines, and we're actually running tests on it. And the 15 minutes is really not turning into 15 minutes. It's really ending up being 20 to 45 minutes per test. And what they don't talk about is that you can only run one test at a time. So if you imagine we get 300 people coming in on an airplane, there's no way to physically test everybody. So we continue to monitor the new testing technologies, and antibody testing or serum testing, where we're taking a drop of blood or something, seems to be the best opportunity for a quick result that could be helpful. But that doesn't exist for COVID-19 right now. But what I tell the industry, hotel owners and airlines, is that we have to reinvent the hospitality industry in order to move forward in this post-COVID-19, and that really means being a partnership, working with hotels about how can they help our guests to be good guests. Identify people who are ill and isolate them so that they can't infect our community here. Really, how can we ask them to check in with us on a daily basis, and if they are getting sick, be able to get them to see a healthcare professional so that we can provide them support. I think all of those things have to be part of a system that would allow us to reopen the visitor industry moving forward.
I want to make sure that we get to some of these viewer questions. Nancy Mitchell has a question, which I think a lot of people are wondering, which is, her comment really, but it can be turned into a question, is they should test at the departing site. Is that practical to have visitors tested before they actually come to Hawaii? Do you envision us having some kind of a system where you have some kind of an identification card or a stamp and a passport that says, I have antibodies, therefore I can travel? Are we how far away is something like, I mean, it sounds wonderful. I agree, Nancy. I would love it if they would test at the point of departure as opposed to the point of entry, but is that even realistic?
I can say that we are talking about this at the governor's level, because we do know that TSA goes through a whole process of screening every traveler before you get on a plane, and trying to extend that, getting IDs captured, more information about where the traveler is coming from would be helpful to us. So we definitely are examining in the whole flight process about checking in, getting on a plane, and coming over, what would be the best opportunity for us to try and execute some kind of test. Now, unfortunately, we don't have an antibody test or a test that can be done very quickly at this point in time, and I think that that's the challenge with trying to implement any of these programs.
Okay, one of the other questions that I'm trying to look for right now that came in was going back to the rainy day fund and possible use of the rainy day fund. If you can explain that, I mean, is the 1.5 deficit before the rainy day fund is used, and after? If you can explain maybe how the rainy day could help with some of the offset some of those costs.
Certainly, Ryan, it's two challenges that we'll have from the state's budget perspective. One is just the fact that revenues will be significantly down for a pretty long period of time. We're expecting that we would get significantly less revenues for a 6 to 18-month period. So, if we are spending more than we're taking in, then that becomes the challenge. So we definitely will have to scale back expenses in order that, we can run a deficit for a period of time, but at some point in time, you run out of money. So the rainy day fund is a one-shot infusion of funds. So that can help us for a very short period of time. But the current budget, the burn rate of the entire state budget is more than $600 million. And the current balance in the rainy day fund is $380 million. So it wouldn't even provide support for more than 2 weeks of a deficit that we need to get a better handle on.
Is that just going to the federal government, or are there places where you see things being cut?
Well, we definitely need to rein in expenses. We do anticipate, as you know, when you look into the visitor industry and you think about how quickly could we have a system in place that people would feel comfortable with getting visitors from around the country or around the world, for that matter, it is going to take time. And so we do see a deficit for, as I said, 6 to 18 months. And we have to get the expenses more in line with the revenues coming in. And so we would see a reshaping of government, some way to reduce the personnel costs. We've already placed a freeze on all purchases and non-personnel related expenses in state government, and we'll probably continue that into the next fiscal year. But there are so many mandatory expenses that the state has, debt services, contributions to the retirement system, contributions to the health fund system are all costs that is very difficult to delay, because those costs accumulate every single month, every single year.
Another question, a number of questions that are coming in, still dealing with visitors coming into the state, the 14-day quarantine. We know that Colonel O'Carroll said last week that they're working on improving that efforts and trying to close some of the loopholes. Do you have any idea of what some of those maybe new procedures might be, or what other steps might be taken to sort of make sure that those loose ends get tied up?
Well, certainly, Ryan, we're working on two fronts. One is just to get the procedure a lot cleaner. So, making sure that we can do some verification on the incoming, wanting to, especially if it ends up being that they list a residential property, some way that we can verify whether it's an illegal vacation rental or, whether it's some other property about that. We've also explored the idea of creating certified locations where the hotel or the facility agrees to be a partner with us in helping to implement the quarantine. There's very strict guidelines about what happens when someone is in quarantine. They don't get the normal hotel services. They have to stay in their room. They have to have food delivered to them. They can't go out to eat. And all of those kinds of parameters. And what we want to invite the hotel industry is be a partner, and maybe we could do a certification program. So when the visitors arrive, we can check whether they're in a certified location. If not, they require them to get to a certified location so we can be certain that they're not coming in and then getting lost someplace in Hawaii.
Yeah, I think a program like that would help a lot. I think a lot of people really have a lot of uneasiness about the people who are coming right now. Jay Southey III asking, when will he make a decision to extend? That's what everybody wants to know. If it's not April 30th, how long will it be? And when are you going to announce that?
Certainly we're in discussions with all the mayors as we speak. I have a meeting with them every day at 11 o'clock, and we are talking about that. And we do expect to make an announcement in the next few days, clearly before the end of the week.
One of the other things going into this now, week 4, what are your thoughts or your worries about people just getting more complacent? I mean, it's been for over a month now that people have been sort of asked to stay home. Do you worry about that people might just think, all right, the numbers are going down, it's a beautiful day, why not just go out for a little bit? I mean, is there any sort of fear with that people's just overall complacency with this?
Certainly that's a big concern, Ryan, but I can say that people have been complying with the orders to the large extent. I mean, we all know that there are some people who will refuse or leave the house, but the overwhelming majority of people have complied and have stayed at home. So it is an ongoing concern, and that's why we are looking at and thinking about how can we, in phases, restore some areas to normal activity. That would help the economy, that would help revenue to government agencies, that would help people maintain their mental health and allow us to sustain the overall social distancing for a longer period of time.
Okay, well, we know you have that call with the neighbor island mayors in 3 minutes, so we don't want to take any more of your time, but we do sincerely appreciate you coming on here and sharing your perspective with us this morning. Thank you so much, Governor.
Thank you. Yeah. Thank you, Yunji and Ryan. And I really do appreciate you guys allowing me to connect to the people and respond to their questions. And so just thank you for having me on your program.
Thank you. We'll see you again soon. Take care.
Yes. Take care.
Okay, so there were a lot of unemployment questions. Don't think that we are ignoring that, but we do want to take those kinds of questions to someone who can answer very specific details. That, of course, our special guest tomorrow.
Yeah, Scott Murakami will be here to talk more about some of the updates that they have. The department has launched a new website. They've also opened up sort of a command center that they are working on at the convention center that they're going to be starting to roll out to just kind of help with some of the backlogs. So we know that there are a lot of questions. We're actually going to ask about some specific questions with the unemployment process, because there are a lot of people who are saying, look, I applied online, but I didn't get a confirmation. Does that mean I apply again? Or there are people who are saying that they applied, they got the confirmation, but nothing else. So we want to sort of build out those different scenarios and allow him to sort of explain what each person should do should you fall under this category. So again, he will be here tomorrow. I'm looking forward to answering, because we know a lot of people on unemployment and really relying on those checks.
And I know a lot of you are frustrated. We didn't get to all of your questions. We got to as many as we could. And I think one of the big headlines there, Ryan, he's basically saying we are probably looking at an extension of the stay-at-home order in some form or fashion, and that he's going to announce that before the end of this week. So we should get more guidance on that. I think a lot of what stresses people out, I know in my own case, is just the uncertainty, the not knowing, the thinking, is it April 30th, is it not? So the more clarity we can get from government, I think the better we all will feel about what's happening.
And also, I think, also going off of what he said, will be sort of determined a lot by the islands, and if there are stricter enforcements on each island, that is something that we could also see as well. So, but we also want to
we'd like to highlight a Hawaii hero, and that is Kamanu Composites today. Typically, they make canoes. Now they're making face shields, and they have done an amazing job. They've made their first 5,000. They're going to make another 3,000 per week for the next 2 weeks. They are available for purchase, or you can buy them to donate. They've already donated, let's see, 1,500 to Hawaii hospitals, also EMS, different community organizations. They are really doing an amazing job. These are very cool face shields. Unlike some others that we've seen, they actually have a band that goes around the head, and then the shield itself can come off, and you can buy more replacement, like the actual plastic. But it's really amazing to see what this company has done, a local company that's really stepped up. They've gotten some support from the Hawaii Community Foundation along with some other organizations. So we just want to give them a shout out. Check them out. If your business needs some of these, they look fantastic. KamanuComposites.com. So we just want to send a big mahalo to them for all they're doing for our community.
And again, if you have anyone who you would like to highlight in a Hawaii hero, make sure that you enter that into your comments. We like to highlight one of those things happening every day, or one of those individuals or organizations that are helping our community. Also still happening today, there's actually more testing that's going to be done today. The city continuing on in their testing efforts. We saw a bunch of them over the weekend. Today there'll be a Cocoa Head Park. For more information, you can head to oneoahu.com or .org for more information on that as well.
We talked at the top of the broadcast with Dr. O'Carroll about masks. Today, of course, the first mandatory mask order in effect. That's an island-wide on Oahu. And statewide really encouraged, and a lot of businesses won't let you in if you don't have one. So bottom line, you need one. And if you don't have one or you want to buy one, Nina Wu in the paper has a great article on where to purchase or get a face mask, some free resources and some other places you can buy them. She's constantly updating that resource. So check out that article by her, bookmark it. If you need, the doctor said we need at least 5 because we have to wash them every day.
That's right. Yeah, and another great article is a resource that is available, I believe, for those parents that may have children, and the paper has a link to the childcare providers available for essential workers. It's a spreadsheet with location, phone numbers, what groups they take care of. So I encourage you to go online to check that out and find more information about those locations and services.
And this list actually is a list of all the people that the Face Kamanu Composites has donated to. So you can see there, those are all the wonderful people that they've donated to. But yeah, the spreadsheet is also really awesome. So if you are a first responder, or if you're an essential worker, if your work has been deemed essential and your child care center has closed, the paper has that spreadsheet with all of the child care centers that are open.
And again, we have been highlighting this for the past week or so, Aloha Trace, really encouraging people to go online to take this. Again, one of the ways that we beat this is by finding out who in the community has had contact with it and some of the other things that are happening around us. So we want to encourage people to head on over to Aloha Trace, alohatrace.org to take this really quick survey. It takes a few minutes, and it really can be beneficial for the entire community.
Yeah, we appreciate all of you being here. Make sure you tune in tomorrow. If you or someone you know has an unemployment question, you get to go straight to the source and ask Scott Murakami all of those questions. We appreciate you being here on this Monday. Once we stop the live stream, please go back and watch our talk with Dr. O'Carroll if you missed it, and watch our full broadcast with the governor as well.
We'll see you all here tomorrow at 10:30. Until then, aloha.